So this is Healthy BR, which is the Mayor's Healthy City Initiative. And so we're here today to engage with the medical community, the nonprofit community, the for-profit community, and elected officials and state representatives to engage in an understanding of what health priorities are here in Baton Rouge and try to narrow them down to 4 priorities that we're going to focus on for the next 3 years.
Really excited about today, bringing together over 100 community partners to give input to shape the next evolution of the Community Health Needs Assessment. This is a requirement from the Affordable Care Act that hospitals create community health needs assessments every 3 years. And so with the Mayor's Healthy Cities Initiative, hospitals have come together with community partners since the initial 2012 assessment and worked as a community to shape that assessment and then work on a single implementation plan.
What are some of the major health issues facing Baton Rouge?
Sure. So it's everything from infant mortality and having healthy babies to obesity and living healthier lives to HIV and STIs to cardiovascular disease and stroke.
When the conference is over, what would you like people to keep in mind?
Sure. So we want people to feel engaged in the process so that when we go down this road of trying to make Baton Rouge healthier, they'll be engaged in the process and help us try to improve health outcomes for all people in Baton Rouge.
I represent Louisiana's federally qualified health centers. Here within Louisiana, we have we now have 35 organizations who operate more than 250 clinics. In the Baton Rouge area, we have 6 clinics, and those clinics are St. Gabriel Community Health Center, Open Health, Care South, Baton Rouge Primary Care Collaborative, Southeast Community Health Systems, and Primary Care Providers for a Healthy Feliciana. And so we provide comprehensive care to our patients. We provide that access to care that always looking for. And our comprehensive care that we provide is not only primary care services, but dental services, mental services, and enabling services and vision services. What we found, though, is that, and as Ms. Barrett said earlier, access to care is maybe about 20% of the issues when our patients come into our clinics. When they come into our clinics, there are other issues that we are helping them with: case management, making sure they have access to social services and those types of things. But I'll just give you a little background of what we do. We deliver high quality, culturally competent, comprehensive primary care as well as supportive services to our patients. We provide services regardless of ability to pay. We operate under the direction of a patient majority governing board. So our boards at each of our organizations are actually those that are receiving services. 51% of our patients or our boards are made up of the patients that are receiving those services. So they're empowered to make decisions for their communities and access to care. And what I'll say, because I know my 5 minutes are probably down to about 2 minutes at this point, is that what we found is primary care and dental services and behavioral health services are not the only services that are needed. And when we need to connect to specialty services, it's an issue. There is a lack of access to care for our patients. And our patients, I'll tell you, 52% of our patient base is the Medicaid population. We also see the uninsured. We see insured individuals, and we still have issues with access to care for specialty services. And so although we're here in the state and we're in, I think it's about 55 of the 64 parishes, there are still issues with trying to connect the dots from primary care to specialty services. And so it is something that our clinics work on every day. We're working with the hospitals. We have critical access hospitals. We have our small rural hospitals. We have our urban hospitals, our rural health centers and things of that sort. But we found that it takes a community effort to be able to provide access to care, because it's not only about providing healthcare services, but also as you look at the social determinants of health, there are many different issues that also affect the patients that we serve. Thank you.
Good morning. I am the Director of Early Detection and Education at Mary Bird Perkins Our Lady of the Lake Cancer Center. And so usually when I talk to a group, I always ask if there's anybody in the room that has not been impacted by cancer in some way, whether it be personally or by someone that you know. And it's rare that anybody raises their hand, and so I'm going to assume that that's the same for this group and say that you won't be surprised to know that East Baton Rouge Parish has a higher incidence and mortality rate compared to the U.S. for all cancers combined. But the exciting news, and the reason that I'm always eager to meet with a group like this, is because we now know that through lifestyle modification and by adhering to the screening guidelines that exist, we can eliminate 50% of those cancers. And so we have some power here to make some change in our community. Some of the work that's already being done is we're seeing an increase of resources available to individuals to help them quit using tobacco, one of those lifestyle factors that we know really impacts their risk of developing cancer, and not just resources through counseling, but also through helping them get some of the other aids that assist them through the quitting process. Every week, if not daily, we're seeing research about how diet and limited physical activity impact your cancer risk. And so we're able to take that research and translate it into a way that we can share with the community and help them see how that doesn't just pertain to heart disease or some other chronic illness, but that there is also a connection between physical inactivity, diet, and their risk of developing cancer. Improved access to early detection. Everybody is saying that access is not just having insurance, and so using mobile medical clinics and other resources to bring cancer screenings into the community setting so that people have access to them very readily, and then helping people understand the role that HPV vaccination plays in cancer elimination, and that is a cancer prevention tool, and that is why we offer that vaccination. Thousands of cancer screenings are being provided in our community, and so there's an opportunity there to make people aware of them, because it's one thing to have them, but people have to know that they exist and be willing to utilize them. And so that gives us an opportunity to measure a lot of these things and not just say, oh, it felt good to deliver it, but what was the impact? Are people beginning to initiate screening and then continue that process annually or whatever the guideline is? What are our mortality rates? Are we seeing people that are diagnosed early? If we can prevent half, that means half of the people still will develop cancer, but are we doing things that will save their lives ultimately? And then are people quitting and staying quit? Are they increasing their physical activity? Are we making that available to them through other resources? And so the last thing I want to leave with is that while 2,000 new cancer cases may be diagnosed or 700 people may die, we know that those people belong to someone. And so that impact is much more far-reaching than just that 2,000 people or that 700 or 800 people. And so that's why I'm excited about this work. We know that we can prevent 50%, and then we'll work to save the other lives.
Greetings, everyone. I'm Coretta Lagarde, and I'm the Director of Community Health and Stroke for the state of Louisiana at the American Heart Association. And as you already may know, the state of Louisiana, compared to the rest of the United States, it's 49th. We're ranked 49th in our health challenges, and it goes back and forth between 49th and 50. Our biggest challenges are the high prevalence of obesity, the premature death rate, and also cardiovascular deaths. In Baton Rouge, based on Robert Wood Johnson's county health rankings, we're ranked number 27 out of the 64 parishes in Louisiana. And those behaviors are added to the adult smoking, physical inactivity, as we talked about, and food insecurity that hinders our progress in the right direction. At the American Heart Association, we have a 2020 impact goal, which is by 2020 to improve the cardiovascular health of all Americans by 20% while reducing deaths in cardiovascular disease and stroke by 20%. And while we're looking to reach or be close to that reduction in death, due to our science, technology, and research, based on previous estimates for our health portion of the 2020 impact goal, we're only going to be at 3.5% increase. Our current estimates have us maybe getting to that 5% by 2020. And although that is an improvement, it is still clear that we have our work cut out to achieve the cardiovascular health portion of that 2020 impact goal. And it makes this time, 2017 to 2020, a critical period of moving a needle forward. The data from the work in progress session compares the NHANES data from 2007 and 2008 to the data from 2013 and 2014, and that's the latest available data. So as you can see in the green box for the adult and youth, we have seen the reduction in the poor category, improvement in the ideal category for smoking, blood pressure, and physical activity, and total cholesterol for older adults. Yet in Baton Rouge, our percentage percentages are still higher ranked than the U.S. national averages in these areas. In the red boxes, you see that there's an increase in youth and adult moving to the poor area and a decrease of adults and youth moving from ideal category to intermediate for BMI. And that's the same for glucose in adults. The American Heart Association is working to change and improve our numbers throughout the community on morbidity and mortality due to cardiovascular diseases and stroke by building a culture of health guided by our impact goal. And what that means in terms of how the capital area impact is impacted is that 1,800 Louisiana lives are saved per year. We save lives by working to make system change, policy change, and conversation change. And I'll start a little bit with system change, and that's basically improving the chain of survival and that access to care, as was discussed. And in Baton Rouge, we do have one hospital that's a Get With the Guidelines hospital that's being awarded for their commitment to quality in health care. We have over 212 local schools participating in local Jump Rope for Hearts and Hoop for Hearts campaign, which teaches heart health techniques. And we have 8 teaching gardens from the AHA in schools. Also, all of the high school students in this area are being trained in hands-only CPR. Changes in public policy and industry standards benefiting the numbers of people that are changed can occur in the state or local level. And for example, one of the biggest improvements that just happened was the recent smoke-free Baton Rouge policy pass. So the American Heart Association worked with a broad group of organizations, some of them are represented here at the table, to help make East Baton Rouge Parish a community where every employee has the right to clean, smoke-free air. The American Heart Association also has worksite wellness initiatives, workplace health solutions to improving the workplace environment for all adults and people that are working here. We also have the privilege of working with healthcare organizations and hospital systems such as all the FQHCs to promote a new blood pressure initiative to help change the conversation from identification to the how to control aspect of high blood pressure. And that means that we are changing the conversation. We're changing the conversation throughout the capital area from a monologue talking about cardiovascular diseases to a dialogue with a lot of the players here at the table, including yourselves. So what's next for cardiovascular disease and strokes? We have 5 strategies, impact strategies for the next few years. One is high blood pressure, cholesterol, tobacco control, and new emerging trends and priorities for reducing sugary drink consumption, especially in children, and reducing salt consumption. So thank you for your time.
Good morning. My name is Kathy Carmichael, and I'm a registered dietitian and certified diabetes educator at Pennington Biomedical Research Center at 6400 Perkins Road, if you haven't been by the big cement building that is part of the LSU system, just a few miles from the main campus. We've been sitting for a few minutes today. I have a question for all of you. If you know someone with diabetes, stand up. If you know someone with diabetes, stand up. If you know 2 people with diabetes, raise your hand. If you know 3 people with diabetes, raise your other hand. If you know someone with pre-diabetes, sit down. Thank you. That was good. Everyone got some exercise. All right. So we do a lot of different things at Pennington. There's about 500 people that work there. I cannot address all of the things that we do today because there are scientists working on so many different parts of the body and in so many communities and crunching numbers and drawing blood and doing exams and other things. But we have many, many researchers working in the field of diabetes. The pancreas is the organ that is primarily affected by diabetes. But I'm not going to make you stand up again. But we also are thinking about the brain and the heart and our feet and our eyes, because these are all organs that are affected by diabetes. In Baton Rouge, diabetes is a major problem. According to the Community Needs Index, the report that was published in 2015, 11.1% of the East Baton Rouge population has been diagnosed with diabetes. So that's 11.1 people out of 100. That's a lot of people. So this is a major problem that we want to help synergize. I really like that term, synergize, because I know all of you work inside your building, wherever you work, at the Heart Association or at another institution or at Humana, and you also may have family members that go to public school, private school, church. We all have an obligation to have diabetes on the brain when we're serving food or when we're planning meetings or all of those different activities. The reason I mentioned pre-diabetes when I had you stand up is that that's relatively new. When I started as a dietitian, not new, but using the term pre-diabetes, when I started as a dietitian in 2000, we didn't use that term pre-diabetes. So this is actually a good thing. It's giving us information for the future. We have a study at Pennington right now that I'm involved in called D2D. We're no longer recruiting, but the specific group that we were looking for were people that had pre-diabetes, so not frank diabetes. That is important because then someone can hopefully keep diabetes at bay. Also, when we're thinking about diabetes, we're thinking about type 1 diabetes, when your pancreas shuts off and doesn't make any more insulin. Type 2, gestational diabetes. And then also children that have diabetes. We have the pediatric obesity, the Childhood Obesity Conference and Public Health Conference coming up at Pennington on November 15th. I don't have a hashtag for that, but you can Google it. So if you want to come join us and be in the discussion about childhood obesity, we need to make sure our kids and our families and parents can help know about diabetes. If a child is overweight, they are at risk for diabetes. There's a ton of stuff on my slide. Anybody in this room who is above 45, you should be tested for diabetes. Anyone who has a risk factor for diabetes, the teeny tiny words on the right, you should get tested at 35. So I'm done. I've already should have been tested. I'm older than 35. We talked about that synergy again with income, with education. So we know someone that has a lower income is 3 times more likely to have diabetes. With a lower education, more likely to have diabetes. Just to highlight some great things that I know that are happening in the community, we have diabetes awareness. Today is the first day of Diabetes Awareness Month, November. Great things that the local associations are doing. There's collaboratives around town that are helping prevention projects to really reduce screen time for children. So the gamut for diabetes is so long as far as prevention and then management. So for a lot of my career, I worked at a FQHC where I was on the management side, whereas I feel like now I'm a little bit more on the prevention side. I was at my child's school yesterday in East Baton Rouge Parish talking to a parent who was fixing the planters in front of the school, and I said, "How you doing?" She said, "I'm not doing very well because my friend just died from diabetes." So this is very serious, and I want us to be thinking about where we are. If the only beverage that is served is sugar-sweetened beverage at an event in Baton Rouge, that's a problem. There should always be water. If you go to a party, you bring the water. You take the healthy food. It is our obligation, and we can hopefully engage our community to start thinking that way, to make the healthy choice the only choice.
Good morning, everyone. My name is Renee Antoine. I am the State Director of Maternal and Child Health Services for March of Dimes. March of Dimes has been a leading organization for about 75 years in reducing preterm birth rates, infant mortality, as well as birth defects. As you all know, Louisiana ranks amongst the worst for infant mortality, preterm birth, and birth defects right now. Coincidentally, today is November 1st, the first day of Prematurity Awareness Month. November 17th is Prematurity Awareness Day. Please wear purple if you have been affected or impacted or know someone who's been affected or impacted by prematurity in their lives or in their communities. So March of Dimes is trying to lead the cause in premature birth rates because it is the leading cause of death for infants. If you all don't know that, East Baton Rouge Parish ranks at 12.3% is their infant mortality rate annually, and that just came out today from the March of Dimes National Foundation. Louisiana is at 12.6%. There are about 1,200 babies born weekly in Louisiana. Out of that amount, 150 are born preterm, meaning prior to 37 weeks. About 100 are born between 34 and 36 weeks, which is late preterm. And about 27 are born very preterm, which is less than 32 weeks. So those are going to be our NICU babies that you see that are fighting for their lives every single day. those numbers are startling compared to some other national states. And so specifically for East Baton Rouge Parish, not only do we have a preterm birth rate problem, we also have a racial disparity problem. 1 in every 7 babies of African American descent are born premature. That's 14.6% compared to their Caucasian counterparts, which is about 10.4%. The goal for 2020 for healthy babies is an 8.1% average. So you can see that we have a very, very far ways to go, but we can do that with their help here today. So March of Dimes has several different campaigns for prematurity collaborations with organizations across the nation and even globally. Research, trying to figure out the biological and genetic causes of premature birth and ways that we can impact that even before pregnancies are taking place, right? Making sure that families and specifically women are acting as if their bodies are pregnant before they actually conceive. We're realizing that we cannot impact infant mortality after the baby is born as much as we can impact it before the baby is conceived. So preconception health, the health that you have for your body before you conceive, is vitally important for our women, especially in East Baton Rouge Parish, because of our disparity rates. Community education, we have several programs right now. Healthy Babies Are Worth the Wait. Reducing non-medical early elective deliveries, meaning when those women and families are coming in and they're wanting to go into labor early because of maybe some social pressures or just not wanting to be pregnant anymore, right? Pregnancy is a hard race. We want to say, hey, it's actually best to make sure your baby comes on his or her own unless there is a medical reason to deliver early. And so we have a program called Healthy Babies Are Worth the Wait. It's a national program that Louisiana is a part of, and we encourage all families to make sure that they're having full-term births, at least 39 weeks if helpful. Access to family planning methods. We all assume that with Medicaid expansion and all of the great efforts we have with policy and government affairs, that we all have access to contraceptive methods and family planning methods. It's actually not true. If you ask the average woman in a community if she is happy with her birth control methods, she may say no. She may actually say that she doesn't feel empowered to share that story with her physician. So we want to make sure that families have equal and equitable access to family planning methods so that we can reduce the number of babies that are being born too soon, and we can actually have birth spacing that are at least 18 months apart. Some women are conceiving too close together, and that's also one of the leading causes of prematurity. Early and consistent prenatal care. So Go Before You Show is a campaign that we also have in Baton Rouge, as well as Region 7, which is the Shreveport area, making sure that as soon as you find out you are pregnant, you call your local provider and make sure that you have folic acid, that make sure that you have multivitamins, and to make sure that you have the nutritional needs to take care of yourself from day one of your pregnancy. Community impact. We all know that the loss of a child is really immeasurable when you ask a family that's sitting in a NICU or that maybe did not get to bring their baby home. The financial burden on our state, $5,000 versus $55,000 is the difference between a healthy baby that is brought home from the hospital maybe 2 or 3 days after birth versus a NICU baby that has to stay in the hospital up to 2 weeks of their life. $5,000 versus $55,000. Billions on a nationwide scale when it comes to healthcare costs. To wrap up my summary, these premature birth rates are preventable. There's something that's called epigenetics, the influence between the environment and the social causes of our health disparities. We have research now that actually shows that we have excess mortality in the state of Louisiana, meaning we are losing babies that we don't have to lose. Hundreds of babies each and every single year that we can all do something about. And I love the term preventable because it just means that we haven't acted or we failed to act on something that should have been acted on a long time ago. And so just know that March of Dimes, you can go to www.marchofdimes.org to find out all of this information. It is Prematurity Awareness Month in the month of November. You can wear purple to show your report for that. Prematurity Awareness Day is November 17th. If you are interested in seeing Louisiana's report card, it is available on our website, and I'll also be sending out several different media advertisements for our grade. We did receive an F for the 10th year in a row, just to let you know. We are among the worst in the nation, and we really want to get those premature births down. So thank you.
Yeah, good morning. So I am associate professor in kinesiology at Louisiana State University and an adjunct professor at Pennington Biomedical Research Center. And I want to start by saying just a couple of things. One is my primary focus is research, not really outreach to the community. And I think we tend to get stuck in this tunnel, in particular with healthy living, where we conduct millions of dollars of research every year in order to look at how to make people in our community healthier. And where we fail is translating that research into actual action within our communities. So this was a big learning experience for me in order to go through these programs, these community programs and these activist programs that are ongoing in the community right now in order to try and improve health. And I have the daunting task to talk about obesity, which we all see in our community as one of the major problems that we have that's facing our nation, and in particular facing Louisiana. I put some statistics in here, and you have to pardon me because I am a researcher. My life is in numbers. So, I mean, if you look at where Baton Rouge, in particular East Baton Rouge Parish, sits, at least the data that I was able to obtain, we look like we're sitting about 21 out of 64 within Louisiana itself, which honestly isn't that bad. But when you consider that Louisiana, depending on which metrics you look at, sits between 49th and 51st if you include Washington, D.C. area in the nation, we're sitting in the middle of a state that has the worst health in the nation. And I think we can do much better than that. You know, and for me, I come from a really small town in South Dakota, which has, I think, the 7th ranked in the nation in terms of health. And my family and friends push me all the time to move back. They want to know why I'm here in Baton Rouge. And when I teach my classes at LSU, this is what I tell them. I say, look, we are in an area that needs the research the most. We need the funds, we need the research in order to try and improve our health. And obesity is one aspect of it, but it's a huge aspect of it. It involves social and community-based programs in order to change the obesity. It is associated with an increased risk in basically everything that is talked about at this table, including cardiovascular disease, stroke, pregnancy in terms of epigenetic imprinting that may influence the baby's lives before they're even born, diabetes especially. Now, I'm going to work my way around this in a little bit of a counterclockwise direction, and starting with community impacting, you know, in terms of us having about 36% in Louisiana being obese, there's an additional 34% or so that are considered overweight that are trending toward obese. And this means that in our state, about 70% of the individuals are obese or at risk for being obese very quickly, which is a big problem considering the risk of other diseases. And it is a disparate disease. It affects women more than men, slightly. It affects the African American and low socioeconomic areas hugely in our community. And what surprised me, my son first went to Bernard Terrace in Baton Rouge, and you know, in the gifted program, and to be able to see the kids that go there that have food insecurity, sometimes those are the only meals they get when they're in schools. You know, and we need as a community to do better at trying to provide access to good food for kids, because kids' obesity levels and kids' health track from where they're at, whether it's genetic or environmental or whatever the factors are that are influencing it, they track into adulthood. Now, the yearly cost for obesity, and I think this is horribly underestimated, in the U.S. is about, if I remember right, about $150 billion a year. When you get into diabetes, you're talking $300+ billion a year in extra medical costs. And in terms of a per person per year basis, it's about $1,400 or $1,400 per year extra medical costs. Now, the work in progress is fantastic. I mean, I'm reading through the initiatives, and I'm looking at the programs that are involved, and the hospital systems and the communities are involved. The community activism is there in order to try and promote this, and you see this in the outcomes. In the outcomes, we have corner stores now that provide healthy foods. We have a reduction in activity deserts. Supposedly, the access to places for physical activity in Baton Rouge area and East Baton Rouge is 95%. I disagree. We can do way better than this. Now, I see the trails starting to pop up, the bike trails and the walking trails, but we can do much better than this. I think if we want to look to somebody, look to Toronto, Canada. I mean, they have some of the best outlays for physical activity within their community, and they're safe. and looking at the state and federal research funding that's coming into this state, I mean, Pennington and LSU are very well funded in order to conduct research, but it needs to be put into the communities, and I think that's really where a large part of our research at Pennington has been going lately. To me, if you're looking for milestones and measurements, number one, we need to understand who these people are. We need to understand where they are. If you look at the sample sizes that in the CDC that are describing the rates of obesity and the rates for lack of physical activity or inactivity and diabetes, you're sampling about 1% of the population in East Baton Rouge. That's not good enough. Right? We need to understand who these people are, how to get them access to good foods and physical activity, how to get them access to good health care in order to promote a healthier Louisiana. Now, we've had progress. If you look at the trending rates of obesity in Louisiana, 10 years ago, we were about 20%. Okay? About 8 years ago, we were at 35%, and we've started the last couple years to make us a steady plateau. But we can do better. We need to understand who they are so we can track their changes over time so that we can help them get access to food, find more physical activity programs for community-based programs, and especially in the kids. I mean, we do research in kids at Pennington. I can't tell you how sad it is to see African-American girls walk into Pennington who already have diabetes and they're 16 years old. I mean, what kind of quality of life does that produce for an individual when they're at that state already at that young age? So I'm done. I'm off my soapbox. Thank you.
All right. Hey, good morning. Thanks. I'm going to stand up because that sign's kind of blocking us on this end of the table. I'm Dr. Bo Clark. I'm the East Baton Rouge Parish Coroner. And as the coroner, I usually speak last. So that's a coroner joke. Okay. Nonetheless, one of my jobs when I ask people, what do you think the coroner does? A lot of times they'll say, well, you pick up dead people, right? And I like to think it's a little bit more than actually just physically picking up dead people. Well, my job really is to investigate why people die. And when I investigate why people die, I'm really looking why they die, and especially if it's of unnatural causes. So when we talk about injury prevention and people dying in our community of unnatural causes, the list is long, right? We can talk about our high homicide rate. This year we've broken a record, the most homicides in East Baton Rouge Parish in its history. We can talk about our opioid epidemic, where we see that continually climbing because we're in the midst of people dying from opioid-related deaths, and certainly the things we've done to try to mitigate that. But what I want to talk to you about is a particular type of death that I've identified in this community that is 100% preventable, right? So think about that. I'm going to tell you about death that doesn't have to happen at all. And what that is unsafe sleeping with babies, with infants. So everybody here probably has heard the term SIDS before, S-I-D-S, right? Which stands for what? Sudden Infant Death Syndrome, okay? So let's talk about another syndrome real quick. Everybody's heard of AIDS, right? Acquired Immune Deficiency Syndrome. AIDS is caused by something called HIV, right? Okay? What do you think SIDS is caused from? Right, exactly. Nobody knows, right? So we have this mysterious disease that's been labeled out there, and tons of research has been done, and what we've discovered is we don't know why it happens. And the reason for that is because it's misnamed, right? SIDS doesn't really exist. What exists is something called SUID, sudden unexpected infant death. And the cause of SUID is something called positional asphyxia. It's basically in two scenarios when you take an infant, and that's someone who's from 0 to 1 year of age, and you place them in an unsafe sleeping environment. That may be either in an adult-sized bed with an adult or an older sibling, or it could be in a crib that they're surrounded by a lot of things that they can get entrapped from, okay? And you put them in those two scenarios, and it ends up deadly. I've investigated over 25,000 deaths in the last 6 years. 60 of those have been related to positional asphyxia. All of those were preventable, meaning that number should be 0, okay? So I like to correlate this idea and this plan with what we've done with car seats, right? So when you leave the hospital, right, you have to show them the car seat, you have to put the infant in the car seat, you can't leave without the car seat. Do you know how many deaths I've worked in our community in the last 6 years related to infants that were properly restrained in a car seat? 0. If they're properly restrained, they survive. We know that, right? So what if we did the same thing? What if we taught people how to place their children in a safe sleeping environment, not in the bed with them or with an older sibling, not in a bed with a bunch of adult pillows and blankets that they can get wrapped up in, and we take those 60 deaths to 0. Sounds good? Right? Because you can imagine the impact not only for the community, but for a family when they lose a child related to unsafe sleeping environment. All right? So I'm not just going to sit here and tell you about the doom and gloom of the scenario, but I'm going to offer you some solutions, and the solutions are really simple. It starts with education, right? We educate people that they should restrain their child in a car seat even before they leave the hospital. And the same thing has to be done when we talk about safe sleeping. So in this community, we formulated the Safe Sleeping Task Force, which is made up of my office, along with the East Baton Rouge Sheriff's Office, the Baton Rouge City Police Department, DCFS, and Lexi's Kids. And we have made a campaign to not only educate the community, but when we identify an unsafe sleeping environment, we try to mitigate that, right? Meaning if there's a family that doesn't have a crib to put their child in, and their only alternative is the adult adult bed, we try to get them a crib, okay? We try to show them how to properly use that, because ultimately our goal is to get this number to 0, and there's absolutely no reason why we can't do that. It's a pretty simple thing to do, but we have to get out there and reach the masses so that people can avoid this very tragic circumstance. So that's my presentation. I appreciate the opportunity. Thanks.
I'm the Executive Director of Capital Area Human Services. We're one of the 10, local governing entities that the state established, and we've been established for 21 years. We serve 7 parishes, and East Baton Rouge Parish is obviously our largest, but we see a lot of people. We probably are the largest provider in the state, and every day we see about 360 people, every year about 12,000 individuals, but there's still a big issue with access. As everyone knows, we all talk about mental health, that there's not enough services for people to go to, but also there's a problem with people even knowing what's available, how to get in, and what's required of you to do that, and so that also impacts access. We moved to a walk-in process about 3 years ago now because we felt that it was ridiculous for people to be told, oh, you have a problem, well, we'll see you in 16 weeks. So, within that time, the problem only got worse, and people ended up in the emergency department. So now we have a walk-in process every morning for people to come in, and even if we have so many people, sometimes there's 30 people before 7:30 in the morning. If we don't have enough physicians that day, they'll ask to be come back, but we do have a mental health licensed professional meeting with them to make sure that they're not in danger when we ask them to leave. One of the issues about access is always going to be convenience, geography, finance, all of that, and so we do our very best to really get out of the mental health clinic. I think everybody would agree that it can be very stigmatizing to go into a place that says mental health center, and so we work with primary care providers to put behavioral health specialists in a primary care setting so that people can be seen the same day they're in for a physical health need. They can be seen as well, and we're hoping for that to expand. We're also in 44 schools, and we have great success with the kids there. Their families are happy, the principals, the teachers, the other students, and we continue to expand in these kind of non-stigmatizing ways that people can get access early on, and we have to wait until they're very ill to be able to get in to be seen. One of the things that I had put together on this slide, y'all have seen me talk about this for quite a while. Post-Katrina, through the Behavioral Health Collaborative, we established something called a mental health emergency room extension. Sorry, there's a fly up here. I'm not hallucinating. All you doctors and Bo, I don't need a PC or anything, but that was a community decision to develop something that would be a rapid access for somebody who was in crisis, and it worked extremely well. Unfortunately, it closed a few years ago, and the community's been really struggling with how do we address behavioral health crises. And so the Bridge Center was established, their board is established. I'm very pleased. I was recently invited to join them to look at ways we can address these crises. But as things move forward in this country, and we are seeing more more people with most serious mental illnesses, we're looking at non-facility-based solutions as well. You know, in the past, it was the emergency department and jail, and for Baton Rouge right now, that's kind of it. But places like California are looking to open urgent care centers specifically to help stabilize people with behavioral health crises. And then also, even in other cities in Louisiana, they have a very broad-based mobile crisis team. Right now, I have a mobile team that only serves my most serious clients, but I'm talking to a company in New Orleans that actually sees 35 calls throughout the greater metropolitan area. So we need to start looking at different models, because we can't wait until a facility is established, funded, built, all of these things that are going to delay it. We can't take any more delays. We need to move forward with that. I want to make it clear also that while there are behavioral health services accessible, yes, there are, a lot of people are not even aware of it. DCFS did a whole focus group across the different parishes that we serve, and I'll just tell you that what they found is that parents and adults said, we just don't know where to access services for our kids. And so I know Denise Duga had recently said so many children are being brought to the emergency department of the lake. Well, they need to know where they can come prior to it be a crisis, and that they can get ongoing care, and hopefully it won't be for a very, very long time, but will be an intervention that's appropriate at the time it's needed. Parents also said they don't know about what other resources are there. They want support in how to parent, knowing where to take a child, how to address the issues within the home, how can they make sure that the kid is getting the resources and the support they need at the time that they need it. I need to close because I have my timer running, but I really want you to keep in mind that there's a whole spectrum of mental wellness to serious mental illness. And everybody, every one of us in this room, everybody that we know goes through some phase of that, from between mental wellness and being ill. And I think that we've got to make sure that we get resources as early as possible, that people know where it is they need to go, that they not be stigmatized, that we not kid around and call somebody crazy or mentally ill or sick, but we understand we have to integrate our health, and that we understand physical health and mental health really is all one, and we need to address it in a timely way. So I'm hoping that the collaborative will see a prioritization of helping parents know where resources are, how to access them, and that they are indeed resources in the community for them. I know that Janet, Dr. Peterson's going to be talking about substance abuse. I did want to mention that although I was asked to speak about mental health, Capital Area does provide mental health, addiction, and developmental disability services in this region, and I'm very pleased to be working with the Office of Behavioral Health on these issues.
Good morning. I am Ms. Natalie Cooley, and I represent the Louisiana Department of Health, the Office of Public Health, specifically the STD/HIV prevention program. And so I'm here to just highlight some of the facts that surround HIV and other sexually transmitted diseases that we are being impacted with in Baton Rouge, and especially in this parish, in this region. And what some of you may not know, by 2017, there were a total of 4,080 individuals that have been impacted by HIV. And amongst those, just in 2016 alone, there were 188 new cases. So African Americans are being disproportionately impacted. Of the 188 from last year that were diagnosed, 66% were males, 34% were females, 84% were African American. And another group that is being extremely impacted would be our young people. 43% of them were under the age of 30, and between the ages of 30 and 39 were 26%. So it is really impacting African Americans and youth, and also those who report being gay or bisexual, specifically 69%. And men who have sex with other men are being impacted. So not only is HIV an issue, but we are dealing with increasing rates of primary and secondary syphilis, as well as chlamydia, gonorrhea, and hepatitis. Louisiana continues to rank second in the nation for having the highest rates of sexually transmitted infections. So we have to continue to get on the ground and do our work to help our communities. And We are doing that by having an STD HIV reduction strategy. And with that strategy, it's a plan that we have. We have goals and objectives and strategies from past and present with the STD HIV program that will help us impact this community. And with that, we have direct care services, patient awareness and education, and community awareness and engagement. And so with those, across the state, we have prevention and testing contracts. We have community-based agencies that help us to reach the community by providing free HIV testing. We are now increasing our hepatitis efforts. So literally, we just had a training last week with the community-based agencies in this region, the East Baton Rouge area, where we train them to do rapid hepatitis testing. So now people can get their HIV results and a hepatitis C test results within 20 minutes. So that is extremely, extremely important milestone that we have reached, and we're continuing to spread across the state. And for syphilis, you can actually know your status within 10 minutes. So it's one way that we are reducing stigma with sexually transmitted infections, because people can learn their status extremely early. And our goal is to get people knowing their status and treat it within 30 to 90 days. And amongst that, we have what we call regional task force across the state, where we get together with community agencies and hospitals to come up with strategies to have more community engagement and to try to educate people around congenital syphilis, hepatitis C. We also have partnerships with the hospitals to increase opt-out testing for HIV. We have the End of the Epidemic Initiative, which will bring new HIV infections below the epidemic levels that we are now by utilizing the latest evidence-based tools, such as treatment as prevention, and educating people around PrEP. PrEP is the pre-exposure prophylaxis medication treatment that can prevent HIV if it's taken regularly. And we also have the post-exposure prophylaxis, which can prevent HIV with a recent exposure. And our community is being impacted mainly because of the high mortality rates for those who are HIV positive and for the youth, like I spoke about earlier. So some of the milestones that I want to mention are that persons newly diagnosed with HIV in Louisiana entered HIV-related medical care within 90 days, and that increased from 81% in 2014 to 86% in 2016. So the goal is to not only get people tested, but to also have viral suppression. And viral suppression among persons living with HIV in Louisiana who were in medical care increased from 65% in 2012 to 81% in 2016. This is a milestone that we are extremely proud of, because once you can virally suppress a patient, it's less likely that they can pass the virus on to someone else. And amongst those milestones, we are working on strategies to reduce the number of new sexually transmitted infections and to reduce the number of new congenital syphilis infections. Also to expand the Louisiana PrEP network, which is the pre-exposure medication, and to continue to increase our virus suppression rates so that people are less likely to pass the virus on to their counterparts. And that's all I have for today.
I am last, and I'm not going to ask you to stand up, but I do think you can stretch, because we all do believe in that heart, mind, and body cohesion, do we not? Okay. So Dr. Clark, I'm last, but for all of us, I think we do recognize that substance use disorder definitely has a thread among all the 10 conditions that we're talking about today. And I wanted to take the approach of kind of the statewide perspective as we look at substance use disorders in our East Baton Rouge community, because of the fact that you have a lot of experts here, and we will be engaging in some rich dialogue about how does this drug epidemic affect all of us. So in the 4 areas that we were asked to respond to, I'll start first with past accomplishments. Many of the folks that I talk to in communities, including this one, usually don't have an idea of what's going on at the state level. And at the state level, we have all of these policy boards and commissions and committees that we work on in an effort to identify some policy changes that would affect all of us, and especially in small communities. One of the things that happened last year, the legislature brought together about 45 folks who were looking at the opioid epidemic and identified several strategies that would be successful in several arenas, looking at family issues, community issues, the medical facilities, and other treatment provider agencies to kind of give a broadband template for some of the things that we all need to address when we're talking about opioids. And many of you have seen the news and have heard the president declare a public health emergency. The governor has been very active in looking at the opioid crisis, but you all do know that we've had drug use issues in this community for years and years. And opioid still is not the only major thing that we're dealing with. Alcohol continues to be a drug that affects all of us. So as we have this dialogue together today, I would like to see some really rich discussions about, how does all of the substance use issues affect everything that we are talking about, related to diabetes, infant mortality, the neonatal abstinence syndrome, you'll learn some more about. And there are several resources available to you on our website at ldh.la.gov. We don't have a hashtag yet. So under past accomplishments for that section, I also talked about the Good Samaritan Law. How many of you are familiar with the Good Samaritan Law? Raise your hand. Ooh, okay. Couple people, but I'd like to see everyone raise their hands by the time we have this meeting next year and looking at our past accomplishments for this collaborative. But in essence, what has happened is that at the federal level initially, folks who are have been exposed to a drug overdose situation, they now can report that without getting in trouble with the law. So basically it means that, in the past, when people find themselves in situations where folks are in trouble, they were hesitant to call because either they were themselves using drugs or just did not want to get involved with any situation. So the Good Samaritan Law has been helpful in assisting us with identifying those folks who are in need of services. A statewide standing order for naloxone has also been disseminated or approved, and that just means that the overdose drug is now available for folks in pharmacies, in EMS offices, fire departments, coroner's offices. So we're able to make that drug accessible so that if there is an overdose condition or situation, the drug is available. There are several types that you can learn about as we give you more resources, but they have the syringe, the auto-injectable, and the nasal spray types of naloxone. The other thing that I think we've been mostly involved in at LDH has been the whole Medicaid expansion. I'm sure all of you have heard about that, and involved at some level with how the folks who are getting access to Medicaid services. We've been very, very pleased that in working with the Department of Corrections, that those offenders who are in the correction facilities are able to get their Medicaid card before they are released to the community. And in that way, there is a situation where they can be especially linked up to a provider agency in the community before they leave the corrections facility. I just heard this morning that we have the largest number of offenders who are being released as of this day, November 1st. So we're really anxious about trying to make sure those offenders are connected to services in the community, especially SUD and mental health services. In our arena, Dr. Klosowski talked about our relationship. We talk about behavioral health services that encompasses mental health and addiction. So when you hear the term behavioral health, it really is those two diagnoses that we address under that kind of rubric. For work in progress, in addition to looking at what is available in communities and making sure that we connect folks to community services, our agency works with the 10 local governing agencies, of which Capital Area Human Services is one of them. And many of you who have family members who live in other parishes may have a different LGE than Capital Area, but it is a network of agencies that work together to bring about some support for our consumers who have mental health, addiction, and developmental disability disorders. In addition to that, geographically dispersed across the state is 10 opioid treatment programs. Those programs have been in existence for a while, and specifically for folks who have heroin problems, who have opioid problems, and treated by methadone. So methadone is really regulated by the federal government. There's only like specific agencies that you can go to receive that medication, and we're really working hard with our legislators to look at trying to make methadone more accessible and more available. We have representation from some of our MCOs here today. So we have 5 MCOs that the Louisiana Department of Health has a relationship with, contracts to make sure that the whole continuum of services are available, physical and behavioral health services to our consumers. And within that mix, the federal qualified health centers are also there available across the state, and there are several of those. So as was mentioned earlier, we do have facilities and providers in our community, even in East Baton Rouge Parish, that is working together to make sure our consumers have accessibility to services, but we still have problems with specific types of services. We have problems with getting folks mental health services, especially if they're involved in the justice system. We still have problems with getting folks into detox services in Baton Rouge as well as other areas, and we really have worked hard to try to bring in federal dollars to help us with these crises. Our agency now manages about $23 million from the federal government that we recently received this year to address the opioid problem. And we'll talk some more about that in our breakout session. But in addition to the opioid problem with substance use, alcohol, cocaine, methamphetamines, there's also some other what we call block grant dollars available that the 10 LGEs have access to for substance use disorders. So we work with Capital Area here in East Baton Rouge because they have been a leader in the community involvement, and especially their collaborative now is bringing to the forefront all the issues that are endogenous to even some of the very small areas and communities in East Baton Rouge Parish. And more recently, the legislature commissioned an advisory council on heroin and opioid prevention and education, actually, which will have its first meeting on Monday, November 6th. And we call that the HOPE Council, just happened to be that way, heroin, opioid prevention and education. Like, oh, hope, okay, we do have some hope here. So the HOPE Council, we have a lot of hope and a lot of optimism. And it is a public, of course, meeting, and want to use that really to provide the implementation for some of the recommendations that were shared when we had the first council. So I know my 5 minutes are up, but I'll keep going since I'm last. The community impacted by opioids, I kind of gave you a little dashboard of data here. Around 110 prescriptions are written for every 100 persons in Louisiana, 110 prescriptions. So of course it's important for us to work with all physicians, whether they are gynecologists, obstetricians, general practice, dentists, to look at what is the prescribing behavior of all of these physicians. And there is something called the Prescription Drug Monitoring Program, PDMP or PDM, where we have physicians kind of go in and check to see with their patients, well, how many prescriptions have they received? Are they really, doctor shopping? How can we help kind of curtail some of that? And then we've had the 7-day limit put into operation, where we're asking physicians to really look at, especially pain medication. Does a person really need to have more than 7 days at a time? And especially for those conditions that are not cancer-related or serious pain. So a lot of things have been going on as far as milestones and measures, looking at the number of prescriptions written, the 7-day limits, the offenders coming out and making sure that evidence-based practices are available for everyone who is in need of treatment, and then decreasing the overall deaths and related conditions, because I think, as someone mentioned, someone may be diagnosed with a heart condition and then that's their reason for death, but then what was the impact of drugs in that person's system? Sometimes that get missed, so you don't count that person as having an overdose related to drugs. So I'm really excited to be here this morning, and I see you did put in my bio that I'm excited because I am originally from Baton Rouge. I've been gone for about 40 years and back to the community, and really just want to help in whatever way I can in my position as Deputy Assistant Secretary in the Office of Behavioral Health. But as a citizen, I live right down there in the Goodwood neighborhood, and just really wanted to get more involved with what's going on in East Baton Rouge Parish. So thank you.
It's so exciting to have community stakeholders come together and shape the vision of where we go forward for the next 3 years. I think that's the most important part, is to hear the voice of the community in shaping these plans, so that as we roll out the implementation strategies, you know that you're not too far out in front and you're not standing there alone, that you've got community partners walking with you to address these issues.
Good. How's that new hospital? If people have questions, like more information, what should they do?
They can reach out to us at healthybr.com, or they can email us at healthybr@brgov.com.